High blood pressure is causing serious damage to people right now, and most of them feel absolutely fine. That is the uncomfortable reality I need you to understand before we go any further. Most serious diseases announce themselves. Cancer causes pain, lumps, weight loss. Infections produce fever and fatigue. Heart attacks and strokes, the very events that high blood pressure most commonly causes, announce themselves dramatically when they occur. Crushing chest pain, sudden weakness, loss of speech. But the years of damage leading up to those events, most people feel nothing. Nothing at all. My name is Dr. Victor Hayes. After years of treating the downstream consequences of uncontrolled hypertension in emergency medicine, the pattern becomes impossible to ignore. The stroke patient at 52, the heart failure admission at 65, the kidney failure case at 72. What connects these people is not bad luck. It is missed opportunity for prevention, often over a decade or more. Let me explain how the damage actually happens, where it leads, and how you can protect yourself. First, let us reframe what high blood pressure actually is. Most people think of it as a number on a medical chart, something abstract that doctors monitor. That is the wrong frame. Blood pressure is a physical force. It is the force of blood pushing against the walls of your arteries with every single heartbeat. Not occasionally, not during stressful moments. Constantly, approximately 100,000 times per day, every day of your life. When that pressure is chronically elevated, every organ in your body is operating under sustained mechanical stress. Your brain, your heart, your kidneys, all of them are designed to function within a specific pressure range. When pressure consistently exceeds that range, you are asking these organs to perform extraordinarily complex tasks while dealing with forces they were not built to handle long-term. The critical insight is that the damage happens well below the symptom threshold. Your body is remarkably effective at compensating for gradual change. Systems adapt. Backup mechanisms activate. Function is maintained even as structural damage accumulates progressively in the background. The danger does not come from a single spike. It comes from that elevated pressure applied day after day, year after year, across decades. Let me go through where that damage occurs. The blood vessels themselves are where the entire destructive process begins. Your arteries are living, dynamic structures with multiple layers. The innermost layer, the endothelium, is where the earliest damage appears. It is designed to be smooth, flexible, and responsive to changes in blood flow. Under normal pressure, it functions beautifully. Under chronically elevated pressure, it experiences constant mechanical stress, essentially the equivalent of repeatedly bending a metal component until microfractures develop. Those tiny repeated injuries trigger an inflammatory response. The vessel wall tries to repair itself, but under continued excessive pressure, the repair process becomes part of the problem. The wall thickens, it stiffens, calcium deposits form, plaque begins accumulating at sites of ongoing damage. A healthy artery expands slightly with each heartbeat and recoils between beats, acting as a biological shock absorber, buffering the pressure wave and protecting the organs downstream. As arteries stiffen and lose this elasticity, they transmit the full force of each pressure wave directly to your brain, kidneys, and other organs. And because the vessels are now stiffer, overall system pressure rises further. Higher pressure causes more stiffness. More stiffness drives higher pressure. The cycle accelerates. Now let us go through what this means for each organ system. Strokes. There are two completely different pathways through which high blood pressure causes strokes, and both operate simultaneously in anyone with chronically elevated pressure. The first pathway is through blockage. At sites of arterial injury, plaque accumulates, cholesterol, inflammatory cells, calcium, and debris building up in damaged vessel walls over years. In arteries supplying the brain, this creates a vulnerable situation. When plaque ruptures or a clot forms on its surface, it can completely block an already narrowed vessel. Blood flow stops. Brain tissue dies. That is an ischemic stroke, the most common type. The second pathway is through rupture. Chronically elevated pressure does not just damage vessel linings. It weakens the entire arterial wall structure. Think of what happens when you overinflate any pressurized container. Structural integrity fails progressively, developing weak points. In the brain, where some of the smallest vessels exist, these weakened areas can balloon outward, forming what we call aneurysms. Under continued pressure, an aneurysm can rupture, causing bleeding directly into brain tissue. This is a hemorrhagic stroke, and it tends to be even more devastating. The crucial point: strokes feel sudden. One moment fine, the next unable to move one side of the body. But they are not sudden events. They are the moment when accumulated vascular damage crosses a critical threshold. The process that produced the stroke has been advancing for years. In many cases, the stroke is the first symptom a person experiences of their hypertension. The damage was always silent. The emergency was not. Heart failure. Your heart is a pump. Every contraction must generate enough force to push blood through your entire arterial system. When blood pressure is elevated, you have increased the resistance against which the heart must pump with every single beat. Initially, the heart responds, as any muscle responds to increased workload. It grows. The wall of the left ventricle, which is responsible for pumping blood to the body, thickens. This left ventricular hypertrophy initially helps maintain cardiac output against higher pressure, but it carries serious long-term costs. A thickened heart muscle requires more oxygen. The coronary arteries supplying the heart may not increase proportionally to meet this greater demand, creating a supply-demand mismatch. The heart is working harder and needing more fuel, but not necessarily receiving it, which helps explain why people with long-standing hypertension are at increased heart attack risk even without obvious cholesterol problems. The thickened muscle also becomes stiffer. The cardiac chambers do not fill as easily during the relaxation phase between beats. Less blood in means less blood out. Cardiac output begins to fall even as the heart is working harder than ever. Fluid backs up into the lungs. The liver becomes congested. Legs swell. This is heart failure, not weakness, but a heart overworked to the point of functional transformation. Kidney damage. Your kidneys are extraordinarily vascular organs. Approximately 20% of every heartbeat's output flows directly to the kidneys. They need this high blood flow because filtering waste from blood requires processing enormous volumes through incredibly delicate microscopic structures. Each kidney contains approximately 1 million filtering units, called nephrons. Within each nephron is a tiny bundle of capillaries called a glomerulus, the actual site of filtration. Blood arrives under pressure, waste products are separated out, and useful molecules are reabsorbed. The system works beautifully when pressure is normal. When pressure is chronically elevated, those delicate capillary walls are subjected to forces they were not designed to sustain. Individual nephrons begin to fail. Scar tissue replaces functioning tissue. Filtering capacity progressively declines. Blood tests start showing elevated creatinine as waste products accumulate. Here is the particularly vicious cycle. As kidney function declines, the kidneys lose their ability to regulate blood pressure effectively. They play a central role in controlling blood volume and electrolyte balance, both of which directly affect pressure. When that regulatory function deteriorates, blood pressure rises further. High blood pressure damages the kidneys. Damaged kidneys worsen blood pressure. The cycle compounds itself. You can lose 50% of kidney function before experiencing any symptoms. By the time people feel fatigue, loss of appetite, or leg swelling, damage is often severe and irreversible. I have seen too many patients arrive in acute kidney failure who had no idea anything was wrong, with borderline blood test results from years earlier that were never adequately followed up. Cognitive decline. The brain depends on exquisitely precise regulation of blood flow. Different regions require different amounts of blood depending on their activity. Tiny vessels throughout the brain constantly adjust their diameter to direct blood exactly where it is needed. Chronic high pressure damages these small vessels. The walls thicken and stiffen, losing their ability to dilate and constrict appropriately. Blood flow to brain tissue becomes less responsive to local needs. Over time, this leads to what researchers call chronic cerebral hypoperfusion. The brain is not quite getting enough blood flow, not acutely enough to cause a stroke, but chronically enough to cause cellular damage. The outcome is vascular dementia and vascular cognitive impairment. Brain cells that do not receive adequate oxygen and nutrients gradually lose function. Memory declines. Processing speed slows. Executive function, planning, organizing, decision-making deteriorates. Many people attribute these changes to normal aging. They are not normal. They are the result of years of vascular damage that was entirely preventable. Studies following people across decades show that high blood pressure in midlife, your 40s, 50s, and 60s, strongly predicts cognitive decline and dementia in later life. The damage being done to brain vasculature in those middle years determines your cognitive reserve decades later. This gives both a warning and an opportunity that exists for years before symptoms develop. Why do people not feel any of this? Biologically, there are no pain fibers in your blood vessel walls. You cannot feel the force of pressure against arterial tissue. You cannot sense when those walls are stiffening. The organs being damaged, heart, brain, kidneys, are designed to maintain function even as structural damage accumulates, activating backup mechanisms and compensating until they reach a critical threshold. Symptoms appear late, long after earlier intervention would have been most effective. Psychologically, medicine can detect high blood pressure early, often decades before any symptoms. But this creates a strange disconnect. You go to your doctor feeling completely well. You are told your blood pressure is too high and you need medication. But you feel fine. The diagnosis does not match your lived experience of your health. This is why urgency fails to materialize and adherence suffers. The best analogy I can offer: driving with the parking brakes slightly engaged. The car still moves. You reach your destination, but you are creating excess friction, excess heat, excess wear on components that will fail earlier than they should. You can drive that way for thousands of miles before something breaks, but when it breaks, it is not bad luck. It is the accumulated consequence of sustained, unnecessary stress. What does effective protection look like? Consistent blood pressure control, not just achieving an occasional acceptable reading, but minimizing your cumulative pressure exposure over time. One normal reading during an appointment does not mean you are protected if your pressure is elevated for significant portions of every day. Home monitoring gives you genuine information about your average exposure. Regular cardiovascular exercise most days of the week, not occasionally. Consistent aerobic activity is one of the most powerful tools for maintaining endothelial function and arterial flexibility. Sleep protection. Your blood pressure should dip significantly during sleep. When sleep is inadequate or disrupted, this protective dip is lost and pressure exposure increases. Real food, meals built around whole, minimally processed ingredients reduce the inflammatory burden on your vascular system. And chronic stress management, not as a soft lifestyle suggestion, but as a physiological requirement. When your body is in a sustained stress response, blood pressure never achieves full recovery. Building genuine recovery time into your daily life is as important as any dietary intervention. One final point about the relationship between medication and lifestyle. These are not competing approaches. Blood pressure medication saves lives. The evidence for stroke risk reduction, heart attack prevention, and slowed kidney disease progression from consistent antihypertensive treatment is overwhelming. If your blood pressure warrants medication, taking it consistently is one of the most important things you can do. But medication lowers blood pressure. It does not repair damaged vessels, restore endothelial function, or remove the inflammatory burden that drove the elevation in the first place. Lifestyle interventions do those things. They address root causes. They reduce progression. They often reduce the medication doses required to achieve good control. The best outcomes come from both working in combination. Medication provides immediate risk reduction and buys time. Lifestyle change addresses the underlying biology and creates long-term vascular repair. High blood pressure kills slowly, quietly, and predictably. The damage accumulates in silence. The emergency feels sudden, but it is the culmination of years of preventable deterioration. The absence of symptoms does not mean the absence of risk. It means the opposite. Measure your blood pressure regularly. Know your numbers. Take interventions seriously before the emergency occurs. The people who avoid the stroke, the heart failure, the kidney failure, they are not lucky. They are the people who understood the stakes and acted on them consistently, years before any crisis arose. Please subscribe to this channel and share this with someone you care about. I will see you in the next video.